Well, the Junior Doctors Association says the health department's excuse that they can't be placed due to funding is insulting. Medical graduates are legally required to complete their internships and community service at public health facilities. According to the World Bank, South Africa has fewer than one doctor per 1,000 people. In terms of doctor-patient ratio, this places us under 130th in the world. Well, Dr. Marcelia Theron is one of these young doctors who, while unplaced, faces an uncertain and unqualified future. Dr. Theron, or Marcelia, thank you so much for joining us. I know it was tough to actually come on and speak out because this is such a fraught issue, but you are a second-year intern doctor. You have to be placed by January, and you're still waiting to hear what's going on. And this is not a choice for you. This is your country duty and something that you need in order to get your final go-ahead to be a doctor and serve the country.
Yes, exactly. So you said it very well. Thank you. As of today, we still have not yet heard where we are placed for next year. Due to the lack of funding, it's been a big problem. So the government and the National Treasury need to address the issue and engage in discussion around where we are going to procure the funding to place us as doctors, because, as you said, it is a legal requirement before we are ever allowed to independently practice. So for us as doctors not yet being placed, this puts us in a financial, career, emotional limbo. We are sitting with a very uncertain future. And if we cannot work independently next year, that means that we cannot generate any income, or at least in the form of what we studied for, which is to be doctors and to help our country. So the implications of that on us means that us as individuals, us as primary breadwinners for our families, us as, generating income to support our children, our spouses. Some of us are supporting our parents and grandparents and extended family as well. There are whole family units and communities tied to us and our employment. And of course, the nation as a whole, which I will get to in a minute as well. So a further financial implication as well is that some of us took out large student loans to be able to complete our studies. And now, if we are unemployed, we'll not be able to pay back those student loans as well. We knew that this was an issue going into community service because, as Salma has previously stated, it's been an issue for years now and progressively worsening. But this year's placements are coming out later than in any of the preceding years, and it leaves us with less than 3 weeks to, if it is released today or tomorrow, that is still less than 3 weeks to move our entire lives and our families' lives across the country. And I think that is too much to ask of anyone. And to add to that, I say 3 weeks, but those 3 weeks must also encompass, it must also encompass swapping, exchanging between us where we are placed, and then, of course, to appeal our placements. So for some of us, that will amount to less than a week to really move. So, of course, as you can imagine, that is extremely mentally, emotionally, and even physically, to some extent, taxing on all of us. The suicide rate for doctors in South Africa is already 2.5 times higher than it is for the general population. So it's not a good start to this coming year at all.
Marcelia, I'm going to interrupt you there. I just wanted to say, you could potentially have, for instance, a week to find accommodation in, just say, rural Limpopo, if that's where you're placed. But on top of that,
yes,
we're in a fourth wave. You guys have been serving in the public sector during this time of COVID. A lot of you are probably exhausted and just not only just needing a break, but needing some sort of certainty of where you're going to be placed. And we need you right now.
Exactly. So that is precisely the point that I was coming to just now. I just wanted to give some context to the situation in terms of where we are. But exactly as you say, COVID fourth wave is on our doorstep right now. We as doctors, we understand what that means. We know that people are likely to suffer and, even die without us. So we know our rural communities need us. There are many rural hospital wards and rural clinics that are almost exclusively run on community service doctors. I'm not saying all of them, but a fair few. So we are very worried. So, despite having lost so many of our own, we see our own colleagues passing as well, and we know these people. Despite that, we still want to help. We really want to be a part of the solution. We are trained, we are willing to help, but in the situation and with this lack of funding and placement, we stand at the side and our hands are tied. So, yes, it's extremely, extremely difficult.
All right, thank you so much. We'll reach out again to the health department and see what kind of response we get.